Jamaicans overseas, I hope you and your families are all in good health and keeping safe and calm during this global corona crisis. Some of you have been following what's happening at home closely, but have shared that you'd like some more information. And I know others are hoping to get clarity on recent announcements by the government of Jamaica. These new measures are intended to try to stop the further spread of this terrible virus in protection of you, your family, your community, and in fact the whole Jamaica land we love. These are serious times calling for serious measures if we are to get on top of this thing fast enough so that we can save lives and also bounce back as quickly as possible. So what are the new measures? The ones you might be interested in, and the most recent, is that as of Wednesday, March 18th, until further notice, everyone who comes to Jamaica from a country that has local transmission of COVID-19 must home quarantine for 14 days. What does that mean for you? It means that for 14 days from your arrival in Jamaica, you will need to separate from your family and stay in a bedroom or hotel room by yourself. You should not share bathroom facilities, but if you have to, you must sanitize them every time you use them. You cannot go into any public space for the 14-day period. And if you develop symptoms during that time, you must contact the health authorities at 888-1-LOVE or the other numbers listed on your screen. And no, you cannot call those numbers from overseas. If necessary, arrangements will be made for you to be moved to a government facility where you'll be isolated, tested, and treated. You should also know that as of the same Wednesday, March 18, until further notice, no one is being allowed to have public gatherings with more than 20 people. Bars, nightclubs, cinemas, and places of amusement will all be closed. It might be important for you to also note that the 20-person limit will apply to weddings, funerals, and church services. Again, the intention is to reduce the risk of spreading the virus. Don't worry, pharmacies, supermarkets, and corner shops will stay open, but they have to observe sanitation and social distancing guidelines. Markets will be open from 6 a.m. to 2 p.m. Same guidelines. In this context, and noting that airlines all across the world are canceling flights, and it seems like every day another country imposes new restrictions, I'm once again appealing to you, our diasporans, to strongly reconsider all non-essential travel to and from Jamaica and elsewhere. You might get stuck far from home. In terms of coming home, maybe you can think of it this way. You might feel perfectly healthy, but you could, without knowing, carry the virus from where you are. Your elderly parents, your auntie who send you to school and who you must see when you come every time, or even just people in your community or neighborhood. They might have diabetes or hypertension or asthma, and these are underlying conditions that make them more vulnerable. So it's important that you think about them. The doctors say that most people will only experience mild symptoms. The problem is that it spreads so easily to others who are not as strong. Our health system is also still dealing with dengue and flu season. Although, give thanks, these numbers are down and we are working on expanding our capacity. There's a lot of uncertainty all across the world, so it is important that all of us, that as Jamaicans, we stand together during this difficult time, and that we really think about our decisions and how they affect others. Your cooperation is critical to help mitigate the possible far-reaching impact that the virus could have on Jamaica.